Well, hello, everybody. Good morning, good afternoon, and good evening, wherever you are in the world. I want to welcome Dr. Lily Chen to our podcast today out of California. Hello, Dr. Chen.
Hello.
Hello. She's in the Orange County area, for those of you in that area. And what we want to talk today about is we're going to talk about some really cool things happening in oncology from a holistic point of view. We're going to talk about the microbiome, all kinds of fun stuff. So, Dr. Chen, let's kind of kick it off with a couple questions, if you don't mind, about ozone. So,
Yeah.
is ozone therapy good for our dogs?
Yeah, absolutely. The short answer is yes. Of course, it depends on how you administer it, what dosage, and what's appropriate. But in general, there are a lot of good benefits for pets and dogs.
Great. And before we dig deeper into that, how long does it take to see results from ozone therapy?
That also depends because sometimes it can be as quickly as right after the treatment, depending on what we're treating. Because sometimes I'm using it to treat like a topical wound or infection, and we're flushing it with ozonated solution, or we're treating it with a gas form of ozone, and you can immediately see that wound getting better, getting healthier. And immediately the day after the infection is gone. So sometimes it's immediate. There are certain cases that it would take longer if it's a chronic condition. If I'm treating internal medicine issues, like it's a kidney disease, like those things you won't know until, say, you repeat the blood work, right? But sometimes people have told me that, oh, right after the ozone therapy, my pet just feels better, like they're more energetic. So I would say that it can be something as immediate as like right after treatment to something like, okay, yeah, it builds up over the next couple of weeks or months.
Yeah. So, Dr. Chen, can you tell me what is the concept of holistic nutrition?
I think of it as that you take in all of the pet's constitution, energetics, lifestyle, any disease states, conditions, personality, family preferences, like, yeah, like a very holistic view. So to me, nutrition has never been like, hey, I really like this diet and every dog should be eating this. No, it has always been that a more holistic view means that you take everything into consideration for that pet, the family, all the surrounding factors.
Yeah. Wow. Are you more in the obviously you're about holistic usually means you're about real whole foods. Are you more in the cooked or the raw camp, or don't have any preference?
I'm gonna go back to the what I just said about holistic because it depends. I feel like a lot of my
Okay.
answers are because it really depends on that pet. Raw food can have a lot of benefit in the right pet. Like for example, it is actually energetically cold. So there may be some pets that can't tolerate it. And so it would be not be something that I recommend to all pets and just say raw food is the best versus like gently cooked or dehydrated or freeze dried. I would agree though, the general stance I take is as much as I can help it, I don't like processed food, ultra processed kibble diet. Right? There
Yeah.
are situations where we use it for whatever reasons, right? They're on the
Yeah.
road, they're doing this, or
Yeah.
certain like ingredients, like, so I don't ever say like, oh, you cannot do this ever. It's just, okay, these are our options. And I think this is the best one for your pet. Is that reasonable for your pet and your family? And then kind of go from there. So to me, it really widely varies and is individualized.
Sure. You mentioned cold, that raw is more cold, and that leads me to believe you're referring to TCVM, traditional Chinese veterinary medicine. Am I right? And as it relates to
Yes,
nutrition?
energetics of food. Yes. Yeah, that our
Yeah.
foods and our
So
bodies have an energy.
yeah, yeah. That's a honestly, that's been something I've had really great vets in my life that have done that with my dogs. And it's not really been something I've totally wrapped my arms around. I've pretty much just sought consultation and I followed those directions when I needed to, specifically with my yellow lab, Owen, when I had him. He, he was damp and, you know, hot sometimes. And, we'd see it in the way his ears uh, showed themselves. So that's all I really know about TCVM, and I have a lot of people around me that know it and practice it. But it is very, very specific, and that's one of the cool things about it. That you can look at an animal and adjust parts of their diet so that it keeps them in balance. Am I on point? Hey there, this is Rob Ryan. I just want to say how much we enjoy making this content for you here. And if you are enjoying it, would you like our video down below? And would you subscribe to our YouTube channel? It sure does help us get discovered by more people like you who need information like this. And also, down below in our description, the top link is to our trial pack. We hope you'll order one for your dog so your dog can have fermented superfoods that give them nutrition like they can't find anywhere else. Hard to get nutrients that are easily absorbed. Thank you very much. Now back to the show.
Absolutely, yes. And it can even change throughout that animal's lifetime. And people, you can even feel this as a person, right? Like, for example, I run cold, right? Some people run hot. They're hot all the time. Like some of this is kind of intuitive. So on a hot summer day, you would not want to have a ginger tea because that's really hot, right? That makes you hot or spicy food versus like watermelon or cucumber or yogurt is really cooling. When you eat it, you can feel, right? Like so on a hot summer day, you want to go for a cold watermelon. So that's the basics of that, like TCVM notion of like warmth versus cool. Yeah. And it can be really powerful when you use it the right way. Yeah.
Yeah, yeah. And then, so when we talk about nutrition, we always, I go to the gut right away. So we talk a little bit about the gut now. Like, what are the symptoms of an unhealthy gut microbiome that you may see?
Oh, we see it all the time. I mean, the biggest thing is just the pets every now and then or frequently has soft stool or diarrhea. One of the biggest things that I think we take for granted is that many pet families say, "Oh, my dogs don't have any GI issues." Until I change the food, right? Like if they get their normal diet, like they eat the same thing day in and day out. But if they get into something or we change food suddenly, and then they're going to have blood diarrhea, that is not the sign of a healthy gut, right? We're so trained into thinking like, oh, okay, like if we just keep them on this diet, they are fine. So we just have to make sure that they don't get into anything else. But a healthy gut should be that you can feed anything that the dog should have in a healthy diet. And it's not because like, oh, you change the protein source or you add a different fruit that they're going to have diarrhea. So one of the most common thing that I see in a unbalanced microbiome is just that kind of situations where you cannot vary the diet. It's only good when you don't change things.
Yeah. Do you feel like having like I call it in my dogs like having a bulletproof gut, which means it's really resilient. It can handle different proteins and vegetables, and they don't go into full blown diarrhea by just changing a food. What would be the words you would use to instead of like bulletproof? Like, how do you think about those dogs and their guts that are healthy? What's the goal?
I know my term that I've used every now and then is not like a very pretty term, but I call it a garbage gut. But that's actually like really healthy. Like I think if you have a dog that like if they got into trash and they eat whatever is in your trash, granted if nothing's toxic, they don't have diarrhea that day or the next day. That to me is a sign of really healthy gut because they can digest whatever is sort of sitting there and different things, and may have even spoiled, and they can handle the bacteria, they can handle the pathogens, and they process through the gut, and they still have beautiful normal stool. A garbage gut is actually a very healthy gut.
Well, I mean, especially because Dr. Billinghurst would agree with you. They're scavengers, and they eat all sorts of things, and that is their natural state. So I kind of like garbage gut in a way. I mean, you know, getting into garbage, or, you know, dogs out in the wild will eat prey that's, you know, animals that have been dead for a couple of days, and they're, you know, starting to decay, and they survive, you know, but they're healthy.
Yeah, that's really the
cool.
most kind of like beautiful, healthy gut, is to be able to do that. And that's what they were originally, the gut microbiome should have been, until we trained them otherwise.
Yeah. So you've been in practice, I would imagine, since 2007, 8, when you finished school at UC Davis.
2000, yeah. So I graduated 2007. I did a 1-year internship at a specialty hospital, and then from there I was in general practice, very conventional to start with, and then did start getting into the more holistic side of things, but I would say on the side. And it wasn't until, say, 2018 is when I started my own house call holistic practice. And then from there, this practice is brick and mortar integrated pet, started in 2020.
That's great. Yeah. So, and I know that you've got your acupuncture certification. It's like 11 years now ago, 2013. You've been at this quite a long time. So are you happy you made the move to, you know, more natural, holistic, integrative?
Yeah, absolutely. I actually wish, looking back on my career, I wish that I had this for a lot of cases I saw earlier on in my career. But it's a learning journey. The options I have now, the tools I have available, I feel like not only is easier for the patients, but makes a much more profound difference. I do feel that conventional medicine has its place. There are instances where we have to reach for it. It's really designed as a quick resolution. So it's really good for controlling symptoms. It's just not designed to basically treat the root causes, revitalize the body, and direct that healing process so the disease can heal, rather than just having the symptoms covered up. So to me, it's such a profound way of approaching medicine and being able to individualize it. When I started out, it was, okay, if this is the disease, like let's say you have kidney disease or you have this cancer, there's prescribed treatment. Everybody gets on the same, basically, treatment plan, which doesn't make sense to me now, because within that, like a 3-year-old Chihuahua is really different from a 9-year-old Great Dane. But if they came down with the same disease, conventional speaking, you would treat them the same way, which, like, they get the same drugs or at least get the same treatment. It's just, but holistically speaking, there are so many different options to individualize it, and therefore the body will respond much better long term. So I am so happy that, you know, when I started with acupuncture, that introduced me to the more holistic journey, and then I've been able to keep learning and growing, and meet really amazing colleagues that's been like my mentors and teachers to keep helping me with this and keep exploring different ways that we can help pets get better.
Yeah. What you were just describing a second ago is this basic concept of preventative care rather than reactive care, right? How would you define preventative care? Like, when we talk about holistically, what are the things that are under the preventative care umbrella? In order,
well,
if you can.
Microbiome is one of my biggest things. I always say, if nothing else, let's make sure the microbiome is as healthy as it can be, because that's really the foundation of the immune system. And that is where it's going to try to take care of diseases. So microbiome is absolutely my number one priority. To me, preventive medicine means let's get inside the pet before problems occur, right? Let's try to take care of the body before it starts to break down and have issues. By the time we diagnose a problem, a lot of times it's been there for a long time. And now it is harder to treat when they're already diagnosed with the disease. So I like to find triggers early and get those imbalances treated. So besides microbiome, we look into the nutrition, we look into their water sources, we try to eliminate toxins from the body, look at their vitamins and minerals, and just see if those are appropriate. And then from there, it's just my practice now compared to my life before. I feel that we really see a lot more wellness. I used to, like, day in and day out, I'm just seeing sick pets all the time. And, I would get them treated symptomatically and then just wait until they're sick again. And now what we do is we get patients in for their wellness and address that so that they're not coming in when they're sick. I really don't see as many sick patients these days, which is really cool for me as a doctor.
Oh, I bet. So when you talked about microbiome therapy and addressing those issues, can you tell us what a typical patient diagnosis treatment might look like? And I know every animal's unique. I know you're going to tell me that, but can you give me just a general idea of what you use and what you do?
We always start with microbiome testing, right? Because to me, for as long as I've been doing it, I've never seen two microbiome that are even similar. Like they are so different. So to me, microbiome is like a DNA to that pet. So I always start with testing. So start with your microbiome testing. From there, you can make a lot of good decisions on, okay, what do we need to do? Then it's usually a nutrition adjustment. Okay, do we need more protein? Do we need carbs? What kind of fiber do we need? Because healthy microbiome thrives on fiber. Then we make some decisions about fiber choices. From there, then I usually try to make a decision. Is this gut so imbalanced that we need advanced microbiome restorative therapy? Or can we just start by adjusting the diet, get on good fiber and supplements, and try to discourage the bad bacteria from growing while encourage the good ones? So we do quite often the microbiome restorative therapy, which the technical term is fecal microbiota transplant, a rectal infusion of the gut biome. We do those quite often because unfortunately we find a lot of pets have very imbalanced microbiome. When we do the analysis, you see that they harbor in the largest percentage pathogenic bacteria and not enough of the good bacteria. And when I explain it, I always tell people that to me, it's kind of like a garden analogy, right? If we have a very imbalanced microbiome, it's kind of like a garden full of weeds, right? You can, like if I do nutrition and supplements, I can only try to tend to the dirt of the garden so much. You have to actually seed it with the flowers you want. If I never seed it, it's not going to grow, no matter what fiber I give to this pet. So the microbiome therapy becomes really important. So sometimes they can do it orally. I found that most often that a lot of times we have to do it as rectal infusions to get the results we want. And to me, that's seeding the good bacteria. So we do that quite often. So if I were to lay out like, okay, what does that usually look like for a pet? It usually starts out with a test and then finding the right diet and supplements, and then probably get on some sort of microbiome restorative therapy, whether it's rectal.
Yeah. Some vets just do the oral fecal material. They call them different things. And some do both rectally and orally from both ends. And some vets do both with ozone. So do you always pre ozone when you do rectal fecal matter?
Always. Yeah.
Yeah,
Yeah. We
yeah.
always
I
do it.
think that is probably the superior way.
Mhm.
Do you know Dr. Margot Roman?
Absolutely. I don't think anybody can do any sort of microbiome therapy without knowing her, right? She's a pioneer.
Right, right. Yeah, that's great. Well, I'm going to direct you to we do a magazine and it's free online and it's called Dog Microbiome Magazine. And she's got an article in there that's will blow you away. I'll send you a physical
That
copy
would
of
be
it.
awesome.
And what's that?
Oh, I say that would be awesome. Yeah.
Oh yeah, yeah, because she's got this incredible article that's very inspiring, and
Mhm.
it's a case of a dog that what is his name? It's oh, I forgot his name. So it's like it's not Brutus, but anyway, I forgot his name, but he's a Rottweiler, beautiful dog, and
Mhm.
the stuff that she does is just incredible. She's a unique, very special person. Um, so I'll put that up there for everybody. Dog Microbiome magazine.com, and it's free online. Um, so, okay, so this is very interesting. So you're really into you got a holistic practice. You're very into the microbiome, and you also have a podcast uh, with like one of the greatest titles. My dog is better than your dog. So what I should have thought of that. What is your what is the meaning behind that? Tell us what you mean by that. My dog is better than your dog.
The podcast is a long time making, but we literally just started. I just recorded my first guest episode yesterday, so it's brand new. My
Congratulations.
thought, thank you. My thought behind it, so everybody, I'm sure around yourself and if we work in the pet world is that people would come in and say, my dog is the best dog because of this. My dog's the cutest. My dog has the best trick. My dog has, the best food, travels to the best places. And I'm constantly just really being inspired by that notion that everyone in their choices of their pet care has something that's so unique about
Yeah.
what they choose. And that's kind of what I want to dive in. It's about this notion like my dog is so special to me and honoring that bond of knowing, yes, every dog is the best dog because there
For
is,
you.
yeah, for you, right? And it's such a good thing to say in the way that yes, my dog is better than your dog because of this, but not in that tone where it's like superior. Just like we all know, to us our dog is the best dog. So that's kind of what I want to take this podcast and talk about all the unique ways that we're making that unique bond and what we're doing for our pets, like why is that the best thing, and then bring it out.
Yeah, that's great. Are you focusing on what kind of show is it? Is it on experts or pet owners, or how do
Yeah,
you see
it's
your
going
guest?
to be a mix. I want to have definitely pet experts. I want to also, because my circle is mostly, veterinarians for sure. But I've met some really incredible pet owners, and I think their stories need to be heard. And I see some incredible dogs doing wild things, like just on Instagram, right? And sometimes I obsessively follow an account and I'm like, this is my way of like getting in touch with that person. It's like, tell me more. How are you making this happen? Like dogs that go surfing, right? Dogs that go travel the world. Like I want to know all the things about how you're making this work and your story and all of that. So it will be a mix of those stories along with experts coming in and delivering that content more in a world that's not so like it's just about medicine. It's more relatable to everyday life.
Yeah, yeah. Well, can you tell me a little bit more about um, integrative holistic medicine alongside conventional modalities? Like, tell me how you think about that.
Because of my journey, I have a very strong foundation in conventional medicine. That's actually still most of my career, right? So to me, that is always a part of what I do day to day. So
Mhm.
integrative means that we are taking in the conventional and then marrying it with the holistic. And whatever
Yeah.
possible, we're going to pick the best thing for this pet in front of me. So I would say that the conventional is always layered in because I have to understand the disease states. I have to know the science behind it. I know the mechanisms. I know how drugs work. Then I know the side effects. I know what
Yeah.
is possible and what's not. So, and then my brain is taking away like, okay, what are the limitations? What are we trying to achieve? If it's an infection, instead of reaching for antibiotic, is there a way that we can treat this without antibiotics? There's still, certain circumstances where like antibiotics is absolutely the way to go, and that I will say yes to, right? But it's being able to find like, to me, I think the best way to explain it is like find the least invasive way that do the least harm possible to address whatever this condition or the preventive care that we're trying to achieve. So that's how I think of integrative care, is to take the conventional. I think the common misconception that people have is like when you do holistic, you either have to choose holistic or you have to choose conventional. I don't see it that way at all, because all the holistic therapies are actually based on the conventional knowledge of how diseases work. And then you layer in the options, then find out the best path to go forward for that animal.
Yeah. Also, it's like what you said is exactly the way I think of really good medical care for people and dogs and our pets. It's like, I always say it's like the gentlest, lowest hanging fruit first. That, and then if you don't have the ability to do that because of time, you have very limited time. You have to get to more extreme, faster, treatments. But it's always so funny how some people can jump right to like a surgery or a really toxic drug when there might be some options just a couple steps before that. And people don't know that exists.
Yeah, I think that's the thing that we're trying to do, is just giving people options and know that it's not just black and white. It's like if your pet has seizure, it's not just get on seizure medications. There are actually things that you can do, you know, before you have to commit to lifelong seizure medication, right? So that's just one example. I think that it really is trying to find a balance in between the modalities and what makes sense, and try to do, like what you said, like the most gentle, low hanging fruit, and try not to do harm to the body along the way.
Yeah, it's really easy to do the doing harm along the way. You sort of miss the what is that, the forest for the trees.
Yeah. I think so. Like that part. Yeah, no, I just want to say something about that because I do a lot more cancer pets now. And I feel really strongly in pets and in people, maybe even, that the treatments that sometimes we put our cancer patients through ends up to be more toxic than the disease that we're trying to treat. That I think it's really easy to lose sight of like, what is our goal here? And usually it is a good quality of life, and try to extend the quantity if possible. But we get so hung up on doing the quantity, we forget about the quality.
Oh, I'm so with you. I'm so glad you said that. It's like we all look, we all want our pets, animals to live as long as they can. We already don't get them very long as it is. Totally stipulated. But also, like, you have to really just like be cool with mortality, or and so much of us are not okay with our own mortality, and we're really not okay with our animals' mortality. And like, it's just like quality of life and vibrance, and we're always searching for more quantity. But if the quality is not good, like, what's the point of having more? or life when you're hanging on by a thread. So I'm so with you there. I'm glad you said that. So you're seeing more cancer oncology cases, and you're doing more of that in your practice. Is that what you were saying?
Yeah, so we do have a veterinary specialty oncology doctor that works with our practice, and she's also a cannabis specialist. So because of that, we collaborate a lot on, what we're offering to our pets, and because of that, we have been able to see and help a lot of cancer pets and seeing the difference. Again, to me, it's been a journey of treating the pets and kind of looking back on my past life of like, oh, for cancer patient, I used to only really have a couple options like radiation, chemotherapy, and surgery. And outside of that, I didn't have a whole lot of tools. And now, like this whole world of honestly things like microbiome and just supporting the immune system, they can thrive just by having their gut supported, even if they are going through some other treatments. Just having that part supported, like before it was like, okay, the pet goes through chemo radiation, they may have like a ton of side effects. Not if we can layer in the microbiome, we can layer in like acupuncture, get them on the right herbs, they can get through the chemo without feeling poorly. So I think it's a huge win. So we are doing a lot for that.
It's like ozone, for example, in like cancer treatments. I know, having spoken to a bunch of vets that have seen a lot of success with that, like there's side effects to ozone. There are more energy, more vibrance, and better microbiome. Like you get some really great side benefits when you're using it for cancer, and sometimes when you use a hammer as a treatment right at the beginning, there's some fallout to that and some negative side effects. So about cancer issues, obviously all kinds of cancers are treated very differently. There's not a one size fits all. What do you see as a holistic dog cancer treatment options? What do you see there?
There's a lot besides the ones that we mentioned, right? So microbiome is huge. Again, it's a foundation for everything. I always make sure they have a very strong gut, whatever treatment route that we're going to take, or even if they're going to try to fight off this cancer naturally, we need the gut to be working because that tells me the immune system is functioning better. So microbiome is a huge thing. We use a whole lot of ozone therapy. Now I cannot practice medicine without incorporating some sort of ozone therapy because there is an application in almost every scenario. And there are all kinds of different treatment options for using ozone, to like as easy as a rectal insufflation of just the gas to as advanced as a transfusion of the blood mixed with ozone. So we do a lot of ozone therapy. I started doing mistletoe therapy, which also is gaining traction with people. A lot of IV vitamin C therapy, and that's really individualized because high dose IV vitamin C also have been extensively researched in people to be very beneficial for cancer patients. And now I'm beginning to look into other IV therapy as well besides vitamin C. And the cannabis, we do lean on our specialists a lot for utilizing cannabis and its power because cannabis therapy has direct anti-tumor effects. So, and then layering in all the things that we've talked about previously, making sure nutrition and water sources are clean, making sure the body is balance with vitamins and minerals. One of the most common thing in cancer patients is that they're very vitamin D deficient, and I don't know why, but that's just not routinely checked. We check it in people all the time. Your doctor will always tell you, how your vitamin D is doing. I will tell you that most of the pets I checked are deficient in vitamin D, and that has actually been linked to certain diseases and cancer. And I think there's a huge component that we're missing in our general care. So in terms of cancer, there's so much that we can do for them.
Yeah. Well, we see it in our people if you're low, if you're under 30 in your vitamin D for people, you're really susceptible to some serious
Mm-hmm.
problems with viruses and bacterial infections. You could really go
Mm-hmm.
down pretty quick. I mean, isn't that why like the flu is so dangerous, can be dangerous? It's what's one of the reasons,
Yeah.
if you have a low vitamin D level. Yeah.
Yeah. Yeah. So we that is aside from microbiome, vitamins is one of the main things I always check in all my pets, and most of them are
Yeah.
vitamin deficient.
Wow. Yeah. That's really interesting. I love vitamin IV therapy. Um, do you ever use a product that's called poly MVA? Have you ever heard of that?
I have. I am not. I don't know enough about it, but I have heard of it.
Oh yeah, you'd love to. And they're in Orange County. You should reach out to them.
Yeah.
We just did a podcast with Al Sanchez, the CEO.
Mm.
His father kind of discovered it. He didn't invent it, but he discovered it, and it's just great. It's just great
Mhm.
for everything from oncology use to wellness. It works at a mitochondrial level,
Mhm.
passes a blood-brain barrier. Really great stuff. But you mentioned layering, which I loved hearing you say, because that's how I think of medicine and wellness. It's, you got to think in multiple layers. It's never any one
Yeah.
thing that
Yeah.
is probably going to cure you of any ill.
Mhm. The best thing is actually getting the body as healthy as possible. I think when we think of cancer, we're thinking like, oh, cancer is this bad thing. We got to get it out. They're trying to like poison it. We're trying to like surgically cut it out. We're trying to radiate it to kill it. We forget that cancer cells are a mutation of normal cells. It's telling us when the body has cancer, there's something going on with the body. Those are their own cells. So instead of like, okay, let's just kill it, you're killing normal cells in the process. What we really should be focusing on is like, well, why it did this mutation go unchecked? Like what happened? Which part of the immune process broke down? Which pathway is broken? Let's fix that because the body wants to fix itself. It's crying for help in this way. It's showing you that it's growing this tumor because there's something broken in the body. So instead of
Yeah.
attacking it,
Yeah.
we need to actually help the body do better. So that's kind of
Yeah.
how I see cancer.
You're almost describing it more like a signal than a disease in a way. Obviously, it's a disease.
Mhm. It's a
But yeah,
disease.
it's like
It's a disease because the body is broken in some way and it's imbalanced. But it's not like a
yeah,
foreign cancer.
yeah,
It's not like an infection. It's not like a
yeah,
virus coming in. Well, I take that back. That's not true for all. There are some cancers that can be caused by something coming in, but a lot of
mhm,
cancers are caused by internal changes rather than something coming in and
yeah.
causing it. Mhm.
Even in the case of you're talking about like probably viruses, protozoa, and things that,
Mhm.
it's just that constant, you know, um, assault on the body. But the body, the point is back to the original point, that body is not prepared to handle that. It's deficient some
Mhm.
way, or it's out of
Mhm.
balance in some way. Would you agree with that?
Absolutely. That's why cancer is more common in older pets, right? Or people,
Yeah.
because when you're younger, it's easier to deal with these insults or changes, and your immune system is more healthy. So that is why we see cancer in older pets. It's because the immune
Yeah.
or the body is just becoming deficient.
Yeah. Well, I've had some vets that have said to me, aging is not itself a disease. It's the the multiple years of the microbiome being out of whack, or the multiple years of lack of nutrition, or the right amounts of nutrition. Would you say that that's more of a function of, I mean, they're together, they're related, because time means you're aging, but it's
Mhm.
almost as, I just want to separate the two. It's not just being old, I mean, they're
Mm-hmm.
really vibrant, healthy, older dogs. How do you think of it, of disease and aging and, degenerative diseases? How do you think of that as it relates to older dogs?
Yeah, I also don't think of age as a disease. Like you mentioned, I have seen some very vibrant 15-year-old
Yeah.
that are
Yeah.
healthier than some like 5 or 10-year-olds. So to me, age itself, just because a pet is older, does not equate to, oh, their body is broken down. However, we do have to, I think we're respectful of the process
Yeah.
of aging, right? Things are going to change. That body is not the same body a year ago, 5 years ago, 10 years ago. So it is
Yeah.
more important to take care of this body at its current state. So to me, aging is it's sort of that flowing process of imbalance of things that may be shifting and where we should be paying attention to rather than saying, oh, if you're getting old, you're going to have issues automatically. No. But if we're doing really good preventive care, then we're staying ahead of what changes could happen and try to address it before it happens.
Yeah. And earlier in the show, you mentioned, you know, where you are today isn't necessarily where your pet is today is not exactly where your pet's microbiome will be tomorrow, or their whole constitution. And so you
Mhm.
back to the point you just made, which you have to just keep evolving as your pet evolves. Now,
Mhm.
probably like, I would liken it to, I have a friend who just told me recently, I used to love vegetables. I don't like them anymore. There's very few vegetables I like. And
Mhm.
I just immediately thought, oh, that's interesting. Like, how did that shift happen, you know, in like 5 years? It just,
Mhm.
we see it in our daily lives, in our regular lives.
Yeah, I think that the microbiome does shift because it depends on so many factors, and we see that all the time as as
Yeah.
people we talk about it what you just described, and then as pets you'll see that the foods that they used to like a lot, like it's not the same anymore. And I see when
Yeah.
because now we do a whole lot of microbiome testing, I can actually track those changes and be able to see the difference. And it's really interesting to make that link and be like, oh, when this happens, sometimes this happens. It's not as exact, right? It's more of an art of because there's still billions and billions of organisms that we can only identify like a small fraction. So, but to me, it's such an interesting concept. I feel that
Yeah.
because there's now a lot more research, this is really at the forefront of medicine. When we know a little bit more about microbiome, I feel like that's really the key of I hesitate to say immortality, but however, it is at least a key to health and treating disease states is to just go back to the microbiome and then allow the body to do the rest of the work.
Yeah. It's the key to more immortality, but maybe not infinite.
Not infinite, but at least
Yeah.
like better quality of life for
Yeah.
sure.
Yeah.
Yeah.
More juice out of life. Like, that's the point of being alive. It's
Mhm.
not to be, confined to a hospital bed, or, you know,
Mhm.
constantly be under the influence of drugs that are like making you feel. I always feel bad for dogs too, or animals, because I don't think it's their natural state to be like spacey and kind of like, you
Mhm.
know, having these weird
Mhm.
symptoms from certain drugs. Um, but they get them sometimes, and they're living these like quasi like out of it states. Um, I mean, short term is fine, but I just think like constantly being under that influence always just makes me feel a little sad for
Mhm.
them. So what you don't yourself practice the oncology, but so how do you work with the oncologist to like support the ozone and all the other good stuff?
Well, in some sense, I do work with oncology because, veterinarians are
Hmm.
licensed in a way that we can treat across all disciplines, right? Like that's how we're trained. Like we're the cardiologists, we're the ophthalmologists, we're the dentists, we're the pharmacologists, we're the phlebotomists, you're just everything. And then we do surgery. Like I feel like veterinarians are one of those professions that we are trained across all discipline. Of course, it takes a specialization to really then hone in on what they do best. So I do routinely treat all my oncology patients, and then our oncologist provides that specialist insights in some of her trainings that are not something that's in my expertise, right? And then be able to collaborate and say, okay, we think that this is the best treatment for this pet. So that's how we collaborate. I do routinely do oncology in that regard, because there's some things that I'm trained with that our oncologist is not trained with as much. Like she is not trained to do a lot of ozone therapy. So then we would have a conversation about that, right? And I'm not trained in a specialist way of like cannabis and the chemo protocols, radiations, and then I rely on her specialty to give me guidance in those regards. So it's a very synergistic and collaborative experience, and we see our oncology patients together.
That's great. That's I think probably the best way to go about it. And you mentioned so many layers. I mean, the fecal transplants, ozone, nutrition, of course, IVs, and then ozone. Did I say ozone yet?
Yeah.
There's just like already that alone is like throwing some really powerful natural do no harm therapies at a dog with cancer, and then you can take it from another, whether it's surgery or some other medications or such. From the oncology point of view, it's it's probably what I'd want to do if I was unfortunately dealing with that with my pets.
Yeah, I think so. We think the best cure for cancer is actually prevention, right? We know in people that by the time a person is diagnosed with cancer, they've actually had it for years and years, like something like more than 10 years. For pets, we do believe it's hard to know the data, right? But by the time we diagnose cancer in pets, that's probably been in the body for a couple of years already. So, and in some ways, because our cells are always mutating, we are treating, all of us are living with cancer. It's just whether it's a really big macroscopic disease versus it's microscopic and we can't see it, but it's there. So the best prevention or the best cure is now. And it's always a good time to start cancer prevention, because it's, by the time we wait till it's really big, then it gets harder.
Yeah, no, I love that. The best cure is prevention. That's great. Well, maybe we'll end on that note, and we have to do another show again together and maybe go down some other rabbit holes. I know that you do, you also do house calls.
Less so now, just because of my time and availability. So I'm not taking on any new house call clients. Like I have existing one that have been with me a long time, but currently I am unable to take on new ones.
Yeah. And there's also the Orange County, California traffic, which makes
or just Los Angeles in general. Yeah, for sure.
Los Angeles in general. Well, that's another reason when you find a really great vet, folks, engage them, get to know them, get connected to them. And I mean, look, Dr. Chen is staying with her existing clients, and they're so lucky. Like everybody else is getting turned away, and they're so lucky. So
we do see them at our practice, like our brick and mortar. I do see new patients through here. I don't travel. I don't do the mobile work for new patients, but they can come to our practice. Yeah.
Yeah, I understand. And your practice, once again, is Integrative Pet.com. And is it just you? Do you like who's normally there that when they go there, who will they get to see?
Primarily me and the veterinary oncologist. If it's, a specific cancer cases, you will be meeting with Dr. Trina Hazar, who's our oncologist. Mm-hmm.
Yeah, great. And you can get just go to Dr. Chen for a little bit of ozone right up the bum, and it's like get a dose of oxygen. I mean, what we haven't even said honestly, like how do we boil down what is ozone therapy in dogs and our pets?
What is it? Sorry, you cut out for a moment.
Yeah, like for people who don't know.
Mm-hmm.
Oh, I'm sorry. So for people who don't know, when they hear ozone, like what's that? It's a gas.
Yeah.
What is it?
Yeah.
Just break down simply what is it for our pets?
Yeah, absolutely. So our normal oxygen that we breathe in is O2. We know that, right? So ozone, in very simple terms, is O3. It has 3 oxygen molecules. It's a very unstable gas. That's why it doesn't just exist. We have a machine that specifically makes it. So once you make the O3, it's because of its instability, it likes to, that extra oxygen just wants to go off, right? So depending on how we do it, once we make the gas, and we would mix it in different treatment plants. And the what you're mentioning is like the rectal ozone, which is the most common and most gentle form. So when you introduce the O3, you can think of it as that extra oxygen just breaking off. And now it can help deliver more oxygen. So the simplest way of thinking about ozone therapy is having extra oxygen available for the body, because most of our disease process can be due to like oxidative damages or the mitochondria not being healthy enough because it hasn't had enough fuel and the oxygen to be able to do that work. So having extra oxygen that can be available for these cells is a huge, huge thing for health.
Right. That's great. And it's just so easy. It's cheap in terms of veterinary costs. It's relatively inexpensive. I shouldn't say cheap. It's relatively inexpensive. I think that's fair. And it's just so healthy. It's like a wellness strategy. It's like, people go sometimes like to these oxygen bars when they, breathe in a bunch of pure oxygen. Well, this is another way of doing it for your pets. That's really easy. Yeah, I'm very pro ozone. I love ozone. Well, Dr. Chen, thank you so much. It's been really great spending some time with you. And if you're in the Orange County, especially Palos Verdes area, look up Dr. Chen, and she's over at integrativepet.com. Thanks again, Dr. Chen.
Yeah, you're welcome. Thanks for having me.
Good luck on your podcast too.
It's a journey. It's fun. I'm having fun with it.
All right, everybody. Thank you. Thank you so much for watching, and we'll talk to you all soon. See you soon.